Welcome to the Distinctive Dermatologist, the podcast for professionals in dermatology. Our goal is to help your practice stand out and deliver the ultimate experience for your patients, so they schedule repeat visits and refer your practice to their friends. We're here to help your practice become more profitable. Here's your host, 7-time best-selling author, in-residence faculty member at High Point University, Hall of Fame professional speaker, and member of the Sales and Marketing Hall of Fame, Scott McKain.
And welcome to this edition of the Distinctive Dermatologist. I'm Scott McKain, and as always, the Distinctive Dermatologist is brought to you by GentleCure from SkinCure Oncology. GentleCure, tough on cancer, easy on skin. Well, going on right now is the American Academy of Dermatology convention, and that means that a lot of the folks that we would be interviewing and talking to are tied up with the convention. And as you also hopefully know, we have expanded the Distinctive Dermatology podcast into both video as well as our traditional audio format of the last several years. So I'm going to play some excerpts of a previous interview that I've done with Kerwin Brandt, and we don't often interview folks from our sponsor, but there's some interesting developments going on there. And I also have some really interesting interviews coming up with dermatologists in the next few weeks, so you want to be a part of that. But I thought you might be interested in hearing some of the things that Kerwin Brandt, the CEO, Chief Executive Officer, and co-founder of SkinCure Oncology, some of the things that he had to say about what's going on right now with GentleCure in a highly competitive, highly volatile marketplace as we try to do what's first and always about the patient. So here's some of the interest in terms of the demand that's going on for a non-surgical alternative to non-melanoma skin cancer in the dermatology field.
The message that I really wanted to convey today is just excitement as we think about the path forward. There is a very clear path forward for GentleCure and a very clear path forward for operations as we look into the future. And just I wanted to share a little bit of information. As I look at the activity over since the beginning of the year for both inbound calls into our call center, website traffic. I think we're at about 7,500 calls on average each month to date through the call center of patients and loved ones that are interested in finding locations and learning more about a non-invasive, non-surgical treatment for their non-melanoma skin cancer. And we've had about 450,000 website visits per month since the first of the year, which that's monthly. Those numbers are astounding when you think that there's only about 375,000 patients per month on average that are diagnosed with non-melanoma skin cancer in the U.S. To receive that quantity of input and review at the website level is absolutely astounding. And it really speaks to the truth that we've always known, but it continues to be reinforced. And that is that patients clearly want and are really seeking for a non-surgical solution and really options for how their non-melanoma skin cancer is treated. And so those numbers are affirming that. We are continuing to see, growth in VOBs and growth in the number of patients that are being treated with GentleCure already this year as well. So that trend continues. I don't see it stopping anytime soon. We certainly recognize and see that patients want what you all are offering in the form of GentleCure. And so we want to continue to expand and to continue to grow. We continue to see support and interest. In fact, we signed a couple deals here in the last couple days. And we continue to see new deal volume and new deal growth on a weekly basis since the beginning of the year. We've actually been very involved here as of late with a couple of very large private equity backed groups that have actually come that we've not done business before that continue to move in with an interest in offering GentleCure as they look at what patients are requesting when they come in to their locations, and then they see the number of patients that are leaving to find a GentleCure solution. So we are very positive about the direction that we are headed. And again, we are focused on communicating facts to the patients and making sure that patients understand that they have options, and we will continue to do that. And we certainly appreciate your support and continued growth with SkinCure Oncology and with GentleCure.
As mentioned previously, the Distinctive Dermatologist has always been sponsored by GentleCure from SkinCure Oncology. And the phrase for GentleCure, of course, is tough on cancer, easy on skin. And we try not to make this a commercial for GentleCure. We do a commercial during many of the shows, but we interview all different types of individuals, and also our previous past comments and content has been related to what you can do to make your practice distinctive. Now, one of the things that I find in all of the industries that I work in, and my clients have included everybody from Apple to BMW, Porsche, Cisco, on and on, just about every major influential dynamic company around the world. One of the things I found out working with the top leaders in healthcare, in automotive, in retail, in every industry that you can imagine, one of the things that I've found out is it is important to have your finger on the pulse of what customers really want. If you're not providing what customers really want, once they find out about an alternative that's available to them and you didn't tell them about it, then you've lost trust. I use the example with my friends from GentleCure about Uber and the cab companies that had the very expensive, costly medallions. The first thing that they tried to do was to block Uber from even being able to pick up passengers in their city. But what happened eventually was the new technology won out. You can't block these advances. You can only hope to slow them. Now, it didn't mean the elimination of cabs. There's still cab companies working successfully in every major city. It just means that customers want choice. And so as you consider the future of your dermatology practice, if there's that kind of demand for choice, what does that mean to you? You can either be Blockbuster or you can be Netflix. You can be a cab company or you can be Uber. You can determine which way you want your practice to go. And that's what this is about. Now, in future episodes here of the Distinctive Dermatologist, we'll be talking with some leading dermatologists, and we're going to revamp the format where it's more video as well as audio. Thank you for being a loyal listener, if you have been over the past several years. If you're new to the program, welcome. Please subscribe and please share, because that helps us to attract and retain the viewers and the listeners that are so important to the continuation of this podcast. I'm Scott McKain. Thanks for joining me, and I'll see you next time on The Distinctive Dermatologist.
Thanks for listening, and join us next time for The Distinctive Dermatologist with Scott McKain.